Well, welcome everybody to today's CF Town Hall with information on staying healthy during the upcoming holiday and flu season. Just a few reminders, today's presentation will be recorded and shared on the chapter social media platforms. Just a reminder to keep your microphones muted when not speaking until the Q&A session when you're free to ask questions. All links and materials and resources that are included in today's presentation will be sent out via email to all participants following today's call. And at the end, if you have questions throughout the presentation, you can use the chat feature, which we'll be monitoring throughout the presentation, and we'll do our best to get to everybody's questions at the end of the call. So now it is my pleasure to introduce today's presenters. We have nurse practitioner and center coordinator Stacy Bichl from Lurie Children's Hospital. We have Dr. Janet Yarboi, clinic psychologist with the Department of Pediatrics and Psychiatric Behavior at Rush University Medical Center. And Anna Saulitis, clinical social worker for the Pediatric and Adult Care Centers at Rush and quality improvement specialist for the CF Learning Network. So welcome everybody today, and thank you for participating and presenting on today's call. I think I'll turn it over to Stacy to give us a brief overview on today's program.
All right, thanks David, and welcome everybody who took the time to join us. Here we are, it's the last few days of October. We actually saw a few snowflakes yesterday. And we're looking forward to busy seasons of winter activities outside, holiday times, and celebration. Next slide. It's also the season for coronavirus, which seems to be on the uptick pretty much throughout the United States. It's also the influenza season. And how do we partner that with everything else that comes during this time of uncertainty? So we're going to talk today about how to be smart about staying healthy. We're going to present information on keeping individuals with CF and their families healthy in this season of celebration and winter activity, but also this season of uncertainty. And we hope to provide you all with some useful ideas and online resources for optimizing both your physical and mental health. Next slide. I'm going to talk about tips for maintaining your physical health, and then Dr. Yarboi and Anna will move on and talk about ideas for really addressing your mental health. So with that, my first two rules about talking about maintaining your physical health are: one, to stick to reliable sources for your information. And this is the information age, and everybody has an opinion to offer you about how you should do this. So I really just encourage you to stick to some reliable resources, and I put the ones that support what I bring up in this talk today on the slide. They all have really good information. My second rule is to focus on factors that are in your control, because we know there's a lot that isn't in our control. So it's good to really look at things that you can do to keep yourself healthy. Next slide. I'll talk about a lot of things. Some will be very familiar to you. I tried to present whatever information we know about reducing your risk for COVID and severe illness with COVID, as well as severe illness with influenza. And we'll talk about each of these things briefly. You can go on to the next slide. Starting with one that is familiar to every family that is has someone in their family with CF, and that's infection prevention. We are experts in CF care in infection prevention, so I won't spend a lot of time talking about this. I will just remind people that the bottom line is hand hygiene, and hand hygiene means washing your hands is the best way. If you can't wash your hands, then hand gel is a good second alternative. However, wearing gloves is not considered hand hygiene. And even in the hospital setting, we as healthcare providers are instructed to wash our hands before we put on gloves. Gloves do give you a false sense of security that you are protected, but you can still touch your eyes and touch your face and contaminate things using your gloved hands, just like your regular old skin. So I recommend washing your hands or using hand gel. Second thing, wearing masks. This is not new. This is on every single one of those websites. It's in every for you and those around you. If your child has struggled with wearing a mask or you struggle with wearing a mask, I recommend using the disposable ones. Even though they're not great for the environment, they are a little bit easier to breathe through. They hold less moisture, and they're actually probably a little bit more effective. So if you can stock up on paper masks for when you're going to have to wear them for an extended period of time, that can be helpful. The next thing I'm going to talk about is immunizations. And everyone starts to think about the flu vaccine, and we hear a lot about the flu vaccine. But before I mention that, I just want to put in a plug for making sure you have all your regular scheduled immunizations. For infants, this is being protected against things like pertussis and meningitis. I know a lot of people are worried about going to their pediatrician and being exposed, but yet going unimmunized really puts children at risk for some very preventable diseases. So stay on your scheduled immunization for all children. And then a flu shot. We recommend everyone get a flu shot, ideally by the end of October. We tend to start to see flu start in November, and it does take a few weeks for the flu vaccine to have its effect on your immune system. If you could forward one more click, David. We see a lot of statistics about deaths from COVID and the risk of COVID, but as you can see, even influenza can cause a lot of what we call morbidity or needing to be in the hospital or being away from work, and even mortality. And just in the last 12 months, influenza killed over, well, between 39 and 63,000 people. So get your flu shot. It is within your control. We do have effective vaccines for flu. And so we have that available to us. Please get your flu shot. Next slide. Second thing that you have completely in your control is making a solid commitment to airway clearance. We all know airway clearance is foundational to all other CF pulmonary care. And if that foundation crumbles, everything beyond it is less effective. So we know bacteria like mucus. We know the CF airways have mucus. And so really making a solid commitment to airway clearance, even when you feel well, is a good way to prevent making the environment more inviting to germs. I don't like to advocate for one method of airway clearance over another. I always tell families and patients the best method for airway clearance is the one you will reliably do on a daily basis that you feel really clears out your airways. There are a lot of options. If you have an option that's not working for you, then I encourage you to talk to your care team about a different option. There's the vest, there's the acapella, the aerobica, there's autogenic drainage, there's PEP devices, and there's good old-fashioned chest PT. So finding what works for you that you're willing to really commit to is important to stay healthy. Third, nutrition. Yes, we talk a lot about nutrition in CF. As we approach the flu season, as we look at COVID, what do we know about nutrition? We know that a healthy BMI really supports your immune function, that you're at risk for illness and for more serious illness if your nutrition is not in a good place. We know that a healthy BMI is associated with a better lung function, and that's at any age. So really sort of thinking about your nutrition proactively. A lot of people are home. routines have a little more space in them as far as addressing nutritional goals. I will say that there are people with CF on both sides of this equation. So we tend to think about being underweight, but obesity is also a pro-inflammatory state or causes inflammation in the body. And we know it is one of the highest risk factors for severe COVID disease. So knowing your BMI and your BMI target goal or your body mass target goal is important. And then talking with your CF dietitian or provider about how you can work on that to keep yourself healthy. Use nutrient-dense foods to support that goal. There are healthy foods and less healthy foods. It's not just about calories. And there's a lot of information out there about good, healthy, anti-inflammatory foods. As my dietitian here likes to say, eating the rainbow is the best way to get high quality nutrition. Next slide. Kind of hand in hand with nutrition is vitamin D. So what is the big deal about vitamin D? Well, vitamin D is one of the fat-soluble vitamins, so people with CF are often deficient. In fact, a lot of people without CF are often deficient. We use a lot of sunscreen that blocks your vitamin D absorption. We cover up when we're outside, and we spend a lot more time indoors than we do outdoors, especially here in the Midwest. Low vitamin D levels are known to make you more susceptible to illness. Again, vitamin D deficiency creates that inflammatory state in the body, or contributes to that inflammatory state. And there is emerging literature that says that vitamin D in adequate levels may be protective against COVID illness in two ways. It really helps support our immune's natural defense against viruses, and then it may help temper that exaggerated immune response that we see in people that get severe COVID illness. Some good sources of vitamin D. All our CF vitamins include extra vitamin D because we know CF people need extra vitamin D. And if you do or are prescribed a vitamin D supplement or a CF vitamin, make sure that you are taking them with food. And if you need enzymes to digest food, you need them to take your vitamins with. So partnering your vitamins with eating is really important. Food sources for vitamins, vitamin D, I've listed some here on the slide. Certainly dairy products we all would sort of guess would be a good choice, and it is. But also soy and some cereals are fortified with vitamin D. Egg yolks have vitamin D. Some fatty fish has vitamin D. So there's lots of choices for vitamin D. And then sort of moving on one more from that is sunshine. Getting outside is great during the viral season. We know that viral particles, regardless of what virus we're talking about, are readily dispersed and diluted in outdoor air. So if you're thinking about an activity or you feel like you just really need to see another person, going for a walk outside is probably the best choice you can make. We know that being outside is good for your mood. There's more opportunities to exercise outside. And we also know that some sun exposures will also help your vitamin D stores. It's hard to exercise inside. I find that myself. I think we all struggle with being as active during a pandemic and being reluctant to be in gyms and public places and in team sports. So I turned to our exercise physiologist here at Lurie and said, what can we do for kids when they're at home? And I got a bunch of resources that we are going to pass along to you. A lot of YouTube resources. I think one of the favorites that I looked at was the group HIIT workouts, which is high intensity interval training. And they have some that you can do as a family that aren't really long, like 5 to 20 minutes long. So making that part of your daily routine will be really helpful in staying healthy. There's a few apps, if you can click once more, David, that you can look at that also give ideas for exercising that you can implement indoors as we approach winter. Next slide. Regular CF visits. So again, we do hear from families that they are reluctant to come into clinic. I'm advocating for continuing in-person or telehealth visits with your team. It's really important in CF to be on the lookout for subtle changes in your health, whether that's just a drifting down of your lung function or a drifting down of your weight, or maybe a new bacteria that has found its way into your airways that you don't know about and we don't know about, so we're not treating. So these are regular respiratory cultures are so important. Regular screening labs are also important, looking for vitamin levels, changes in liver function, allergic conditions, glucose intolerance that might be developing. And then thirdly, being really attentive to illness symptoms. And I think most CF centers have the capacity to do telehealth visits. They also have the capacity to provide home spirometry to patients that are able to do lung function testing. The CF Foundation has worked really hard at providing centers with the ability to prescribe home spirometry for all their patients. And that is available to all families without a cost. So if that is something your child can do, lung function testing, or you can do as an adult, reach out to your care center. Having home spirometry allows you to keep an eye on your lung function in between visits, or to report at a telehealth visit where you're at as far as your lung function goes. So certainly think about that. Probably one of the most popular questions that comes to us as clinicians is gatherings. What do we do about gatherings? Here it is, it's going to be Halloween, then Thanksgiving, then all the winter holidays. So what is our recommendation on that? And just like no family is alike and no family gathering is alike, no individual with CF is alike. So the risk is different in different situations and for different individuals. So what you won't hear is your care team, or today in this topic discussion, is a blanket recommendation. Rather, I would say let's think about being thoughtful about your gatherings. Number one, my recommendation is that you pick and choose, right? Is it important to celebrate grandpa's birthday or have a family meal together? Maybe you choose that over going to a haunted house with a group of neighbors. That could probably wait. So being really choosy about the exposures that you have and where you enlarge your social circle. And then thinking about what's happening in your community area. I know Chicago has now made a recommendation to limit your social gatherings to 6 people or less. That's pretty small. I don't know that recommendation extends to all areas in Illinois or everybody that's listening to this call, but be thoughtful about what you pick and choose as you expand your social circle. If you do choose to have a gathering for one of the holidays, the CDC has an excellent page on how to reduce risk for gatherings. Simple things like, if you have the option to be outside, be outside. If you don't have the option to be outside, then ventilate the rooms that you're in. Keep windows open. If you are having maybe 3 households together, like one family and then maybe the in-laws and the grandparents, so you have 3 households coming together, then wear masks when you're sitting around, and when you sit down to eat, have each household sit 6 feet apart at their own small table area. just some real practical ideas that the CDC has put out there. It also lists out, if you can go back for just a second, it also lists out what they consider to be low risk activity, what's a medium risk activity, and what's a high risk activity, to give you some structured evaluation tools to say, well, how high risk is this? Okay, go ahead. Some of the things I mentioned before, being thoughtful about family gatherings and being thoughtful about preparing for them, picking a really unpopular time to go to the grocery store, being bold about telling family members, hey, don't come if you're sick, or being really clear that we are going to ask people to wear masks if they're here, if that's what you decide, so that nobody comes and is faced with any surprises. You know, thinking about how you're going to serve food and where people would normally congregate. Maybe you discourage congregation in small areas or in the kitchen like normally would happen. So just some really practical things are on this website. I encourage you to look at it if you are choosing to have any type of gathering, because we want to prevent a happy family gathering ending up to be an unhappy family sickness a few weeks later. So with that, I think I will turn it over to Anna and Dr. Yarboi so they can talk about strategies for maintaining your mental health.
Thank you so much, Stacy. Those were awesome tips and tricks for following and managing our physical health. And Dr. Yarboi and I will be talking with you about addressing mental health and wellness. I'm a social worker, as David so kindly introduced me, at Rush Medical Center. So Dr. Yarboi and I partner frequently to support and assist families in these areas. So I'm going to take you through a number of different components of mental health and wellness that you can see here today, including in the context of COVID and community, as well as holidays, managing day-to-day, how do we cope as a family unit and help children cope, and how do we navigate the holiday season with a few more practical tips and considerations. And lastly, one of the most important sections, what to do if you need additional help or you're worried about the mental health of someone in your family. Next slide, please.
All right, thanks, Anna. So, you know, this is probably not the first time this year that you have been thinking about your mental health and wellness, coping, self-care. These are probably words you've been hearing since March, hopefully before then, but definitely since, you know, the start of this pandemic. And, you know, in some ways it's good to see that people are thinking more or being more mindful about mental health. And so why is that? Like, why is this something that we're paying attention to all of a sudden? I mean, it should be no surprise that pandemics are widely experienced as being stressful. There is fear, there is worry, there's uncertainty that comes with, you know, this experience, as with lots of other kind of, you know, disasters and kind of, you know, global events. And so this is really actually quite typical. It doesn't make it feel much better, but it's something that we're seeing kind of across the board, and is, you know, something we would expect in situations of kind of unfamiliarity or things that are unknown. So what exactly about, you know, this experience is contributing to increased experiences of stress and distress in our communities? Well, there's obviously COVID itself, and this idea of like a COVID scare. I heard someone use that term the other day, that they experienced a COVID scare, meaning they thought that they might have been exposed and then had to, you know, go seek testing and await results. But there are other things related to the COVID experience that are, you know, adding to our feelings of stress and uncertainty, including, you know, experiencing our own illness, whether it's COVID or something that kind of mimics COVID or looks a lot like COVID, making decisions about whether to go to work or go to school. Also, people experiencing lots of loss, both personally within their families and their work communities, but also just on a grand scale, you know, seeing news about, you know, communities that are being hit hard and hot spots, and knowing that there are lives that are being lost right now. You know, we're also hearing a lot of people, you know, describe feeling like their routine or their day-to-day has been disrupted in some major way. We saw that particularly at the onset when, you know, there were kind of wide sweeping mandates to close restaurants and gyms and schools and workplaces. And that really suddenly shifted everybody, the typical day-to-day for lots of people, including how we sleep, when we sleep, what we eat and how often, people using more substances and alcohol than they might typically use, both to cope, but sometimes just because they're at home and they're sitting around and there's time. Lots of decrease in physical activity, which we talked about already earlier. There's also, certain disruptions that we're seeing more in adults versus in children. For adults that we work with, we're seeing a lot of, descriptions of taking on new roles, both at work. So for some people, especially those who work in healthcare, maybe switching into a new role or having a new responsibility. But particularly at home, parents that are now working at home and are taking on additional responsibilities in the home, including teaching kids and helping facilitate e-learning, things that were not necessarily part of the day-to-day previously. For kids, we're seeing, one of the biggest concerns is how they're adjusting to e-learning and being out of school, how to keep them organized and on track academically, but also making sure that they're getting lots of social and emotional exposure. Also, a lot of time spent on screens, which is something that's been a big concern for parents for their kids even before the time of COVID. But now it's necessary in some cases to spend pretty much all day on sitting on a computer in front of a screen, and that can reduce the time that kids have to do other things that bring them joy. Another big kind of component of COVID and this response and its effect on our mental health has been this feeling of being isolated and feeling lonely, and more withdrawn. Pretty quickly, we had to shift, how we interact with people, and a lot of us have found strategies that work for us, whether it's meeting virtually or being carefully socially distanced in outdoor spaces. But it's been a big change that has been contributing to a lot of feelings of lower mood and feeling quite alone. And then just broadly, this anxiety about the unknown. Things are constantly changing. We, met as a group of presenters yesterday to kind of touch base, and we joked that things might look different, just in 24 hours. And indeed, we've heard that there are new guidelines that are being considered for our state and for the city of Chicago. So there's things that are constantly changing, and it's hard to know what we're supposed to do, who we're supposed to turn to. And just on a broader sense, knowing like how long is this going to go on? We've been managing this for months now, and we're not really certain when there'll be an end in sight. And being able to kind of think about life as we used to know it seems like a really daunting task. And then I wanted to also note that this is all very specific to COVID and the pandemic, but there's other things happening in the world that are contributing to lots of feelings of uncertainty and distress. It's been a year of, pretty notable social and political unrest. We're, a week away from a major election that has a lot of people feeling really complicated feelings. And so, we have this pandemic, but we also have this broader context of the life we're living in America. And for lots of groups and lots of people, that's making it even harder. So, we're hoping that we can use some time today to talk about what we can do to address this. I wanted to spend a little bit of time just kind of highlighting what we know in terms of statistics about mental health in the time of COVID. Obviously, this is still ongoing research, and we probably won't know the full breadth of this until some time after the pandemic has even ended. But what we do know so far, thanks to some early research from researchers working with the CDC, is that there is indeed an increased reporting of anxiety and depression among adults 18 and above in the U.S., which we believe is in response, partly in response to COVID and the pandemic and different restrictions that have been placed. We're also seeing higher rates of substance use as a form of coping, higher reports of trauma and stress-related disorders, as well as increased reports of considerations of suicide. And so just to put this in perspective, I didn't put all these numbers on the slide, but with regard to anxiety, that this 31%, so this is not necessarily a diagnosis of anxiety, but just adults that are reporting symptoms of anxiety, that's 3 times greater than the same time period. So the second quarter of 2019, so the year before. So we're seeing almost a three-time increase in reports of anxiety, up to 4 times increase in the reports of depressive symptoms, and a twofold increase in the endorsement of suicidal ideation compared to the same time in 2019. So obviously there's lots of confounding factors. We can't say that that's specifically because of COVID, but what this does seem to indicate is that as a country, we're experiencing emotional and behavioral changes that are happening kind of parallel to this pandemic. I think it's also important to note that these prevalence rates vary depending on subgroups. So across the board, young adults, and that was people in the 18 to 24 year age group, were reporting the highest symptoms. So for any age group, for any of these issues, the young adults were reporting kind of the highest rate of challenge. It's also important to note that by race, Black and Latinx respondents were reporting higher rates, particularly in symptoms of anxiety and depression and in thoughts of suicide. And then also essential workers and unpaid adult caregivers were reporting experiencing disproportionately worse mental health outcomes. So this is affecting all of us, but it's affecting us in different ways. And some of our most vulnerable groups are being hardest hit. This doesn't include data around domestic violence, but we also know that there has been a reported increase in intimate partner violence and domestic violence reports. And then also I wanted to highlight that we're seeing, as this is all unfolding and as we're experiencing kind of higher rates of mental health issues, we're also seeing changes in our mental health treatment across the board. Some things are actually more accessible thanks to telehealth. So, people who are seeking out therapists or counselors are often able to do so because more people are available through, virtual mediums. But we're also seeing people that are losing insurance benefits due to loss of employment or having financial difficulties, which make it hard to connect to professional. And also some of our in-person group services, whether that's group therapy or intensive outpatient treatments, those are often closing due to restrictions around social distancing and are not able to conduct in their normal way. So some things are more accessible, but other things are actually are fading out. So we wanted to spend some time talking about how this all kind of manifests itself and why it's important, particularly at this time of year. So this presentation is focusing on the holidays, in particular in the holiday season, because for a lot of people, regardless of what you celebrate or how you celebrate, we think of these months ahead, essentially from now through the beginning of beginning of the next year, as a time that we make meaning of, different events, different relationships, and we've kind of decided as a group that this is our kind of protected time to, reconnect. Sometimes we disconnect from other things like our phones and our TVs, but a lot of people try to intentionally and deliberately connect with themselves, with others, and to reconnect with their values as well. And so for this reason, a lot of people look forward to this time of year. They look forward to, the holiday season to do so. And so that can, take a lot of different forms, whether it's being able to gather with your friends and family and loved ones to celebrate different traditions and customs that you might have. It's often seen as a time of, being able to honor the memory of people that have come before you or that you've lost, or create new memories with new family members. It's also a time for a lot of people to engage in religious and spiritual practices, even if they do so all year or year round. This might be a particularly poignant time to engage in those types of activities. A lot of people find interest in giving back to their community or volunteering in different ways as a way of connecting with others. And importantly, it's also a kind of dedicated time for many to engage in, a longer stretch of relaxation and rest after a busy year. And so people look forward to having their time off, taking vacations, perhaps traveling. And then from a more like, philosophical sense or existential sense, a lot of people see the end of the year as a new start or a chance to kind of, start with a fresh plate or create new goals for yourself. And just broadly, it's a time of celebration. We have our favorite movies and music and food that we like to bring back again and again. So for some of us right now, it might be feeling like we're, the picture on the right where, all of our hopes and dreams for 2020 are essentially in the trash. And COVID has, affected our ability to celebrate the holidays in the way that we would like to. But we're hoping that it doesn't have to be so doom and gloom. We're hoping that we can share with you some ideas for how to navigate through the next few months while maintaining your own mental health and well-being.
Thank you so much, Dr. Yarboi, for giving us the context of where to start. My next slide will really just take us through the day-to-day. It's not so specific to the holidays, but just thinking about the situation that we're in today on a Wednesday and how we might be feeling, and some really simple tips and tricks for kind of resetting back into some good patterns to be able to support mental health and wellness. So these tips, like I said, are very simple and straightforward, and I would be very surprised if many of you haven't already heard of these things. Maybe some of you are wondering, why am I repeating this? But what I really want to challenge you to do today while I'm talking is to think about how you're managing with these strategies and how many of these things you actually are doing. So you know them, but how many of these things are you deploying or employing in your day-to-day, and are there ways that you can reconnect back to some of these things if they're supportive factors for you and for your family? So we heard from Stacy about how important the routine of day-to-day CF care is, and that includes our diet and exercise and our overall emotional well-being. And so healthy routines and our everyday activities also are a great way to add purpose and meaning to our day, and then break up a day that might otherwise feel like a very endless stretch that's isolated and monotonous, even if you're really busy. And it can provide some structure for you and your family. So some advice would be to plan each day with a few things you'd like to do or accomplish, and don't feel like you have to take on a huge project like remodeling your whole house or painting some giant masterpiece. You can start really small with goals for yourself, and then reflect and evaluate how you might feel and adjust as necessary. So for some people, this might be as simple as getting up, brushing your teeth, getting dressed, and getting out of bed. I mean, those are really simple ways to start. If you've been having trouble doing those things, try them, and then reflect and address how you feel. Also, take a lunch break if you're working from home or you're doing home school, or even if you're just home during the day doing nothing. Take your lunch break, set aside time to go for a walk or move your body if you're not leaving the home or unable to walk. You can also stretch. So everybody on the call right now, kind of picture where your shoulders are and just relax them a little bit and see how good that feels for your body. And move your shoulders and move your neck, and rest your eyes. We're connected to virtual reality all the time, and it can be straining for us as well too. The next tip here is to make space for rest and relaxation. Many people are now blurring a lot of lines between work and school and home. If we are able to, I know that this is easier said than done in a lot of cases, but if you're able to, try to intentionally make space for work and school, and then set a time to turn that off if you can. That is really important, because if you're working from home, oftentimes there's this idea that there's this endless availability. Maybe you are checking email late in the night, or you haven't really set aside a time to kind of turn things off and start to engage in those restful or relaxing things that bring you joy or help you to unwind at the end of the day, because you don't have that separation of space anymore from coming home from work and having be that safe space to do so. We talked a little bit already about the impact of news and social media and virtual overload, and it's really important to also be aware of the way that social media and the news can impact our well-being. So it's important to tap into how you're feeling. If you have the news on all day, turn it off. Give yourself a set amount of time, engage with it then to feel updated, to feel connected, and then turn it off. think about social media and the way you're using social media. If you're just passing the time scrolling through, I do it. I'd be surprised if everybody on this call doesn't do it in some capacity. But it's really important to recognize how that can make us feel like we're missing out, or feel like we are not able to do the things and compare ourselves and our situation to people who seem like they're having more fun with us, or being more connected than us, or seeing the people that we want to see but we don't get to. That can feel really bad, especially for young adults, especially for kids who may be comparing what's going on in their household or in their community to people who, as you know, Instagram influencers or people on Facebook are designing their pages to look like something other people want to do. And it's really important to have those open conversations and reflections. And the final thing I want to talk about here too, which is something that you'll hear frequently in mental health and wellness, is really being connected to your own emotions and feelings and the feelings of those around you, and feeling open and empowered to be able to talk about those things. Was today a good day? What made you feel this way? What things contributed to this? And on the opposite side, if today was not a good day, if today was a really hard day, if I spent time crying or worrying or feeling anxious, what might I recognize that contributed to this so that I can either build on the strengths that I used to bring to the next day or the next week, or try to avoid the things like social media or TV or spending too much time at work that maybe contributed to me feeling bad overall. And one of the really important things for us to remember and recognize, and Dr. Yarboi said this very beautifully, is that this is really hard. It's hard for everybody. It's hard for people with CF and chronic disease who might be worried about their health with CF on top of COVID, or their loved ones or people they can't see. It's hard for everyone, and it's important that we're kind and gentle with ourselves, and to reflect and recognize that it's okay to not be okay. It's just really important to make sure that you get help when you need it. And with that, I will pass it over to Dr. Yarboi.
And thank you, Anna. A lot of what she mentioned with regard to kind of checking in and knowing, how you're feeling and being able to place your emotions. We have some resources that we'll share at the end that will, help you as an individual or family to facilitate that type of work. So I just wanted to touch briefly on, more specific considerations for working with kids and helping kids cope. I work primarily with kids at Rush, and so I spend a lot of time talking to families about how they're feeling, their kids are doing during this time. And so as we prepare for the holidays in particular, which can be a really important time of year for families and kids, just thinking about ways that we can engage with them and their emotions. So I should want to start by saying that we've come a long way, and a lot of the kind of big and complicated feelings that we were experiencing, in March may look different now. And in a lot of ways, we, as well as kids, have developed some, resilience and have been able to develop some strategies that work for us. So we're kind of out of that peak crisis mode for most families. But it was something that was really impacting kids, early on, not knowing what to expect, not knowing what is, this thing that they're hearing about on the news. So as much as we can, as we continue to move forward, we want to be able to maintain structure and routine for kids. Kids do really well when they know what to expect and they know what's coming. And it can be hard for them to kind of navigate their emotions and their fears and worries if they're in a setting or an environment that feels chaotic or feels unstructured. And so as I mentioned, a lot of families have found that structure. It can get a little bit blurry during the holidays when we're spending more time at home. So just continuing to set schedules, make visuals if that's beneficial for your kids, especially if they're younger, so that they know what's expected, including things that they do anyway, like Anna mentioned, getting dressed, showering, eating meals, doing their, CF care. Make that part of a really clear and delineated routine. Generally, we want to try and foster a positive and safe environment for kids, especially when we're faced with, a threat, which is what we can kind of characterize COVID and this pandemic as. It's something unfamiliar that can cause harm and poses a risk, so it can feel threatening. So as much as we can, we want to try and remind kids that they're safe and that this is a safe time and a safe space, and we're safe people for them. As Anna just mentioned, we don't want to shut down feelings. It's okay to not feel okay. And we want our kids to be able to come to us and tell us if they're feeling down or scared or frustrated or angry. Those are all really valid experiences, and a lot of us are feeling them too. So that's okay. And then we want to reassure kids that those feelings are normal, that they're what a lot of us are experiencing. And then we want, as much as we can, to redirect them onto something that is going to be more adaptive, because while it is okay to feel down and frustrated, if we sit with that for too long and kind of wallow in that, then it can prevent us from doing other things in our life. And so as much as we can, we want to try and redirect kids onto something that's more positive or more forward moving for them. So another thing to mention is that right now we're spending a lot of time on our screens, as Anna mentioned, and we're experiencing some burnout. So we want to try to take time away from screens when we can and engage in some child-directed quality time. And what I mean by that is just being really intentional about choosing activities that are away from the screen, away from the computer, that kids can have some say in. Right now, they might be feeling a loss of control or feeling like they don't have lots of choices. They're just hearing lots of no, and we can't do this, and that's off the table this year. So let's give them some things to look forward to, even if it's something small, like taking a walk and looking at Halloween decorations, or in the neighborhood, or picking an activity for the family to do after dinner. Give kids choices and let them have some say in how we direct the time together that we do have. And as much as we can, as adults and parents and teachers and caregivers, we want to try and model healthy coping strategies for kids, because, like I mentioned earlier, if they're not sure where to look and they're not sure what's happening, they'll most likely look to us and other places. But we have it within our control to try and help shape and model healthy strategies for our kids. And that includes being comfortable talking about our negative feelings, but also demonstrating that we can move on from that with other strategies. And then finally, this kind of fits into just creating, routine and expectations. But if you know as a family that your holiday is going to look different this year, which most of us can reliably say it will, talk to your kids about that. That's not something that we need to hide from them or put off discussing. It'll feel a lot better in the long run for kids to know that and to be able to anticipate that, and then to work with you to find some alternatives in a fun way. Like this can be a fun experience and can kind of re-engage families in a way that maybe they haven't had to do before.
All right, so I'm not going to spend a ton of time on this slide just for the interest of time, because I know we have a few more slides to get through. I just wanted to share a couple of really basic and simple ways to combat loneliness and boredom, knowing that if you are living alone, if you're with a big family, if you've got a couple people in your house or no people in your house, we're still all struggling with the disconnection from the day-to-day social interactions that we might have, even if that's something that we get on our bus on the way to work or school or in the grocery store or passing somebody in the neighborhood on a walk. Since we are trying to be extra careful, a lot of those connections can feel like they are no longer available to us. So here are a couple things. There's quite a few links at the end of the presentation that will be shared with you. I wanted to just advise to explore the world virtually. If you get a chance, if you have access to the internet or on your phone, you can see that there are lots of ways to still tap into areas like art and culture. And I know that I usually start my day with a live stream video of a beach in Hawaii. It feels great when it's snowing in Illinois. And it's wonderful just to hear the waves for a few minutes and transport yourself into a different headspace. So we will skip ahead to the next slide.
And this is kind of an overview too of things that we've more or less touched on already. But the idea here is that there's lots of different ways that we can navigate the months ahead, whether it's adapting traditions that you've been doing for many years into ones that are safer in the time of COVID, or like I mentioned previously, coming up with new things that you can find meaning in, and doing so in a way that is fun and engaging for the entire family. I wanted to touch briefly on this idea that we look for the holidays as a time often to take some time away from work. Sometimes we'll travel. And although you may not be doing that in the same way this year, that's still time that you earned and you deserve to take a break. So I have to tell myself this all the time, not being afraid to take a couple days off of work, take a mental health day, and being really intentional about using that time as an opportunity to kind of reset yourself, even if you're not actually physically going somewhere or doing something novel. And then finally, we talked a lot about determining what is going to be best for you and your family, and sticking to that. And I put an asterisk because, like we've discussed multiple times, things change, and tomorrow you might have a new level of a new threshold for safety and comfort in your family. But whatever it is that you've decided and you've talked to with, your partner, with your kids, making sure that that's something that you stick to and that you can practice communicating those boundaries. Actually, literally maybe practice them with each other and rehearse what you might say to a family member who's like really pushing you to come over for, a big family gathering. It's okay to say no. And the more that you can practice that type of communication, the more comfortable it will feel. And this applies not just to gathering, but also to other things that have impacted families this year, including how you spend your money. Maybe gift giving will look different this year. How you talk about differences of opinion regarding politics, or how different communities are handling COVID. Just knowing what is within your comfort zone and what you feel you can stick with, and not and being unapologetic about that.
And we've touched on a lot of these things too, so I won't go into great detail, but one of the things I did want to point out is, like Stacy said, to consider the necessity of travel and plan very carefully. For some folks, especially if we're thinking about college students, maybe folks who are traveling to care for a family member, if you are going to travel, just make sure that you are talking with the people that you might be connecting with, or if it's within your own family unit, kids, even yourself, to remember to be flexible, to have a plan A, to have a plan B. If something changes tonight and you have to go to plan B, it's something that you are mentally preparing for and expecting. And we talked about this a little bit yesterday, just in our conversations and planning, along with viewing the travel restrictions and quarantine needs and community trends in the states or the counties you may be visiting. There's a link that you can do that on at the end of this presentation, is to think also about the situations where you might start to sway from those best laid plans. So thinking about, you can go into a situation where you know exactly who's going to be there and what you're going to do if somebody comes over and what you're going to do if someone takes off their mask. But after you've had a chance to be with a family that maybe you miss, or maybe you've had a glass of wine or a bunch of pie or whatever it might be, and you start to relax and feel more comfortable, it's really important to know, are you a person who's easily influenced? Are you a person who's easily swayed? What have you done in situations in the past? And while those are all things that are the reality of life, if that's you, if you recognize yourself in that person or another person that it might be something to think about to go to plan B or plan C, just so that you don't end up in a situation where you're feeling more anxiety about what's going on than maybe the hope or the happiness you were hoping would be related to that situation. Mm-hmm. So I will jump ahead to the next slide.
So finally, before we open it up to whatever questions we might have, I just wanted to touch base on this idea that we've spent a lot of time talking about strategies, tips, tricks, ways to cope, and those are generally going to be beneficial for most people. But for lots of people who either have a history of kind of higher level of emotional or behavioral distress, or who have worked with a therapist in the past, or who are just experiencing something new, there might be a need to seek out a higher level of support. And so I wanted to just, make sure that it was apparent, what to look for, what signs and features might indicate that maybe you're someone, or your kid is someone, or your partner is someone who could benefit from additional help. And so generally we want to look for patterns of, persistent changes in mood or behavior. Usually like the 2-week mark is a good indicator, especially if it's happening, if something that you're experiencing every day, then that might be a sign that it's time to seek a higher level of support. If you're experiencing uncontrolled, worried, or negative thoughts that are getting in the way of you utilizing coping strategies that have typically been effective, or are getting in the way of you being able to do things that you typically like to do, or that you have to do, like going to work, those are usually indicators that more support might be needed. And then, of course, if you're feeling any thoughts of suicidality, of engaging in self-harm, if you're feeling that this is all too much and you're feeling quite hopeless, that's a telltale sign that you might want to reach out to someone. And for kids, it might, their challenges might look a little bit different. You might see that kids are acting out in new ways that you haven't noticed before, or engaging in risky behaviors, or are irritable or withdrawn. So that's definitely something to keep an eye out for the younger ones. And if you do feel like you need to seek help, I encourage you to talk to your CF team. Most CF teams will have some sort of mental health professional that they work with closely or could refer you to, such as our teams. So start there if you have the time. If you need something more urgent or you're not sure that you want to reach out to your team, you can always talk to your insurance company to be connected with providers, many of whom are providing telehealth services right now. There's also a number of hotlines and kind of emergency lines to reach out to that I've included in our resource slide. And then as always, go to nearest hospital or call 911 if you're having an immediate concern, such as self-harm or just to hurt others. So yeah, we have a couple slides just with some additional resources, which I think will be shared with you at the end of this presentation today, including some things that we talked about and some that we didn't. So I hope that you'll find something here that's useful for you.
And I highly, highly recommend the CF Foundation's website. The FAQs for COVID-19, those are very robust now, and they are updated frequently. So definitely check those out. If not, once a week or so, you'll see that they are really doing a great job responding to many questions the community has, including now an update about travel and the holidays. And this COVID risk assessment came out not that long ago. It is a great way for you as a family to plot out the things that you might like to do or consider doing and how to evaluate based on risk and contact.
Great. Well, thank you all for sharing all that information. We'd be remiss without sharing a brief update from NACFC that took place last week. First of all, the Foundation's Path to a Cure, which centers around the 3 core strategies to address underlying cause of CF, repairing the broken CFTR protein, restoring it when none exists, and fixing or replacing the underlying genetic mutation to address the root cause of CF. And exciting news, the Foundation announced it's expanding its research collaboration with Sinspira Therapeutics, committing up to 14 million in additional funding to develop non-porcine enzymes, replacement therapy, and a novel treatment to help fight drug-resistant infections. So for more information on NACFC, you can always visit cff.org to find the recordings of the sessions and breakouts. So, and I think Stacy had a little bit to share on COVID, the latest on the COVID impact in the world of CF.
You're muted, Stacy. Uh-oh.
Oh.
Sorry. All right.
Oh.
David, thank you. For those still on the call, if you have a chance to listen to the first plenary, the first symposium on the CF Foundation website, they did talk about the COVID impact in CF. And there was actually some good news in that symposium in that COVID disease has seemed to have a lower prevalence in individuals with CF than it does in the general population. And that's through reports in both the European registry and the US registry. Along with that, the percent of people dying from COVID is much lower in the CF population than that in the general population. There's a lot of research looking into potential reasons for why there is reduced COVID severity in CF. The most obvious reason is perhaps people with CF are just better at social distancing and more cautious than the general population. Secondly, there was some discussion about CFTR modulator use and also chronic zithromycin use, which a lot of people with CF do use as a chronic therapy. But there was also some intriguing information about possibly innate differences in people with CF at the cellular level that may hinder the coronavirus activity in the body. The coronavirus does enter the body through epithelial cells, and there are differences in people with CF in those areas of the cell. So all of these things are early studied and some speculation, but it was good news in that we can have some reassurance that CF individuals are not at as high risk as we thought originally. And why that is not totally clear. And that, again, is still under study. I say this just because I don't want this to be like a carte blanche, like, oh, well, then I'm good. I don't need to be careful. It may just be because we are being careful as a CF community. So keep doing what you're doing, and we'll continue to follow this information as we learn more.
Great, thank you. And we did have a few questions that we might have time to get to that were submitted online during registration. I think we addressed one of them. Should we skip traditional big family gatherings this year?
I think we touched on that. Overall, I would say yes. Traditional big family gatherings where you have 30 or 40 people crammed around the dining room table probably is not the best idea this year. And that's a pretty universal recommendation from all the infectious disease experts across the United States. What you do as far as select smaller family gatherings, I think is variable from family to family. And there are some thoughtful ways to lower your risk and still be able to have celebrations with people that you love.
Great. And the other question that was submitted was, I'm very concerned about the lack of exercising that is being done and the impact on our PFT values and potentially declining. What recommendations can be given for yoga or breathing exercises that can be done indoors in relatively small spaces to promote good breathing exercises, or anything else that will help with preventing PFT values from dropping? And again, I think you touched on that early in your presentation, Stacy.
I would recommend checking out the resources that are online. I also have been recommending some old-fashioned things to patients, like jump roping, which if you have a high enough ceiling, you can do inside your house. It's cheap, it's fun. But yes, trying to find something that you can do on a routine basis, even indoors, is okay. And it's also okay to be outside, as long as it's above 30 degrees or so, or even lower if you're okay with being out in the right gear. But getting outside and getting exercise and walking every day is also a good way to do that. And then finally, tap into the resource for having a home spirometer so that you can actually monitor your lung function at home and make sure it's not creeping down during this period.
Great, thank you. We'll get to additional questions in just a moment as soon as I stop sharing my screen, but I did want to make sure everybody knew about our next CFF Town Hall that's coming up on November 18th. Erin Stocks from our national office of Compass will be sharing a recent update and some more information on the services that we provide to our local community. So let me just check the chat feature to see, but it doesn't look like we had any questions. So if there are none, I am going to say thank you again to Stacy, Janet, and Anna for all of their help in putting this information together and getting it out to the people that want it the most, our engaged CF community. So thank you all again. And just a reminder, this video link will be sent out with an email with all the resources that Anna, Stacy, and Janet put together for you. So look for that. And thank you all for your time today. Have a great weekend, and we'll see you next time.
Thank you.
Thank you.
Bye.
Bye.